All right. Well, buenas noches. Good evening, everybody, and thank you very much for joining us. Here we come together tonight to have a conversation with Dr. Nicole Alexander-Scott. We thank you, Doctor, for being here with us. And this is a constant effort to communicate with the community and to have the opportunity to hear from and answer questions from the community as well, because this is an issue that impacts and it affects all of us. So I appreciate you making the time in your extraordinarily busy schedule and to do this as well. So first of all, I want to thank you and congratulate you. You've been steering our entire state's Department of Health throughout this pandemic, and the challenges have been enormous. This is unprecedented in so many ways. Having to navigate, first of all, the uncertainty, then having to navigate some of the politics involved, and also having to deal with a number of pandemics or a number of different crises at the same time, including an economic crisis, but also a crisis around racial and social justice. So you add that all in and it only made your job and all of our jobs that much more difficult, but at the same time, that much more important. So it's been a pleasure working with you and your team over the past year, and especially over the past several months where our engagements with each other have intensified, and we look forward to continue doing this work. In particular, I want to recognize your willingness and your openness to always hearing our feedback and our suggestions, and your commitment to making sure that the distribution of this vaccine is done in the most equitable way possible, meaning that we're reaching out to hard-to-reach communities. We've had many conversations where you have authorized us to expand eligibility to certain zip codes, 02907, 8, and 9. And then earlier today, we received authorization to expand it to 02904 and 02905. I want to send a message to everyone that there are still appointments available for this very week if you qualify. If you live in those zip codes and you're 50 and above, or if you don't live in those zip codes and you're 65 and above, you can contact my office at 311 or visit our website at vaccinatepvd.com, and you can make an appointment and we'll get you situated right away. So, Doctor, you have not only led the way, but you've always been very open-minded and very willing to partner with us in so many different ways. So for that, we thank you. And we're looking forward to your presentation today and the conversation thereafter. And so I'll hand it over to you. And I look forward to doing this good work together, not just this evening, but throughout this pandemic along with you.
Well, thank you so much, Mayor. Thank you as well for your partnership and your leadership. We have very much appreciated working with your team. Hand in hand, side by side, to do the work that we know is necessary for making sure that all individuals at highest risk of infection, of hospitalization, and of death of COVID-19 are who we are focusing on, particularly that hospitalizations piece with this vaccination rollout. And there are parts that we've done well, and there are parts that we need to improve. And so we are grateful for being on that journey together and continuing to strive for the outcome of making sure the amount of hospitalizations that exist in a certain area, that's how many vaccinations that we're getting out to those places. So I just want to spend a few minutes with all of those who are watching so that we can continue to share the message and the principles that guide the work that we do. Our first is to make sure it's clear safety is paramount. This vaccine has been important to me. I wanted to and have ensured that my mother in New York City is able to get vaccinated. All of her siblings have had at least one dose. And knowing the safety of this vaccine is what gives me the confidence to ensure that those that I love the dearest are safe. And the data and outcomes that are showing when you have received full vaccination, it is almost 100% at keeping people out of the hospital and keeping people alive. And that's what our primary focus is. So I really want to emphasize that safety piece, particularly for those who are listening today. It is working. We want to, by minimizing morbidity, that's that same message, keep people out of the hospital and keep people alive. That is your number one focus for you and for your household. And the best way to protect your household, the best way to protect those you love, is to take advantage of these tools like the vaccine that has proven itself to be able to be extremely effective at keeping people alive and keeping them out of the hospital. We want to make sure during a pandemic that we're doing this as effectively and as quickly as we can, but really making sure that access and equity is at the core. It's foundational to everything that we do. And even if we slip a little bit, we want to make sure we can always get right back on track of that real foundation of equity and access. So our vaccination campaign has encompassed 3 vaccines, Pfizer, Moderna, and the Johnson & Johnson vaccine. All 3 are highly effective at preventing hospitalizations and preventing deaths. And that's the most critical message. They are all extremely effective at being able to do that. Many of you know that the first portion of our vaccination campaign rollout really focused on, particularly given the very limited supply when we started, being extra vigilant at ensuring that the few doses we had really got to the people that were going to be most critical for keeping those at highest risk out of the hospital and keeping them alive. And so we have experienced significant declines in our hospitalization rates. The most dramatic and the quickest in the entire country, far above other states that got far out in terms of quick administration. They did not have the same extent of a drop in hospitalizations that we had early on. Once we were able to accomplish that initial focus with the first phase, we have moved into the second phase, still focusing on keeping people alive and keeping them out of the hospital, but doing it in an approach that's going to help us be as quick as we can. And now, as many of you know, we are in the top 10 of states in the country in terms of percent of doses administered. With all that being said, vaccine supply is still limited. We look forward to the day with each passing day when we have more vaccines than we need. There's no limits in supply, and then we can just focus on getting it to everyone who is interested in getting vaccinated. But until then, we want to continue to take data-driven approaches to getting vaccinated and continue to open it up progressively. So here is your path to free vaccination. There are 3 channels for public vaccination. One is a state-run vaccination site. If you are eligible now, 65 and older, you can sign up at vaccinateri.org. And if not eligible yet, you can let us know when you're in our vaccine interest notification list so that we can inform you when that eligibility will open up. We also have regional or community-run clinics that are led by cities and towns and our other partners. This is also similar to the path that the mayor mentioned that we're doing for the specific zip codes that have the highest rates of hospitalization and the highest case rates. That is where we are opening up to age eligibility earlier in those specific zip codes. And then we also have retail pharmacies, which are opened up for those 65 and older. And you can access that by continuing to check cvs.com and walgreens.com/schedule vaccine or call your local retail pharmacy. We have worked hard and will continue to do what we can to stay on schedule with what we have made public. Our first phase had that more targeted approach that was slower but extremely effective. We have begun to transition into our second phase that is now anyone 65 and older, and we are still targeted for mid-March, where we will go still in the second phase to the next group, which is those 60 and older, as well as those 16 and older with any underlying health conditions. And we have a list of those eligible conditions at our website, c19vaccineri.org. Our focus is to continue to accelerate the timeline and to stay on course, and if not, go even sooner with some of these earlier ages. All of that is contingent on supply. Younger ages, not earlier ages. And then also what's been announced today is vaccinating teachers as well as childcare workers, and wanting to make sure that as many of those that are licensed have access to it over a very quick period of time. We've been able to acquire the vaccines we need to be able to vaccinate those individuals, particularly at a local level through the municipalities. Let them continue to focus on that. They did great with our 75 and older, and to now reach out to our educators, including our child care workers, and continue to have our larger volume state-run sites be able to focus on the other eligibility groups that we want to continue advancing to, so that everything keeps moving forward the way we need to. Here's a list of some of the underlying medical conditions that we are using to start. We based this off of who's at highest risk of hospitalizations. When we looked at our own numbers here in Rhode Island, these were the categories that we were seeing multiple fold increases in hospitalizations among persons with these underlying medical conditions. And then just making aware the vaccine interest notification list, because we are anticipating additional vaccine, particularly what Biden has said over the last couple of weeks. We expect that as soon as we have it, we're able to push it out. And if you're not currently eligible, you can connect with us on our vaccine interest notification list, so that once we get more, we can help make you aware earlier rather than later. So you can just visit our statewide testing site, which also is accommodating this, portal.ri.gov. Let us know who you are, and so we can communicate with you. A piece that I will finish with is what the mayor started with. We recognize that at the core of our response is ensuring that the communities hardest hit, for reasons that we know, because health equity is a major focus for us here in Rhode Island, and addressing determinants of health, those living conditions that contribute to why certain communities are hit the hardest. It's not genetics, it's not, for a particular reason, it's, what we understand to be in the communities where people are most likely to have to go to work and not be able to work remotely, or may be challenged if they miss a day at work, or live with multiple generations in their households. And so we want to really focus in on those zip codes that we know have had the higher rates for those various reasons. And as the mayor said, they are all of the zip codes with Pawtucket, which are the 2 zip codes, the 1 zip code with Central Falls, and the 5 zip codes with Providence. And so we are supporting the city and community leaders in those zip codes on how best to roll out access to vaccines. Central Falls had done a tremendous job, and so we're making sure that we are able to replicate that across these different zip codes, partnering with public housing authorities, food pantries, faith-based organizations, other community-based organizations, as well as advancing to younger eligibility criteria earlier, such that the zip codes in Providence, 02904, 02905, 02907, 02908, 02909, are able to start vaccinating if you are 50 plus. So please spread the word on that, and please help encourage others. We want to use this opportunity to answer questions and address any concerns anyone has. I'm doing this. I want my mother, my loved ones to do this. I want the communities that are hardest hit because of what they are needing to overcome and do to have access to this. And so that's why we're here tonight and ready to answer your questions.
All right. Well, thank you, Doctor. We appreciate that. And Doctor, if I can just out of personal privilege, if I can start the question and answer portion of this. So, you know, a question that I have for you is around the number of vaccines that that we will be receiving. And I know that that's been the limiting factor in expanding this over time. There just haven't been enough vaccines coming. But hopefully we're seeing a lot more vaccines coming to the state. And what I like so much about what you've done is that you've asked for anyone who can help distribute them to step up and run their own clinics. So as the vaccines ramp up and they come to our state, we want to use every bit of capacity we have at our disposal to distribute them. So can you tell me about DOH's strategy for engaging more and more community partners to actually run their own neighborhood-based clinics? And I know that a church recently signed up to run their own clinics. So can you tell us what the requirements are, or how it is that community groups can actually partner with the city and the state to run their own clinics?
Sure. That's a great question. We recognize, even when we have an unlimited supply, these partnerships are going to be critical to ensure that every individual has access to this in all of our communities, especially in our communities that are hardest hit. And the best way to do that is to have vaccination access set up in places that you're familiar with, places that you are comfortable with, community-based organizations, places of worship, housing developments, where people live, where people work. We want to make it as accessible as possible and have access not be a reason that someone isn't able to get a free vaccine that saves lives and keeps people out of the hospital. So we have a team that is focused on engagement with our communities hardest hit. It's led by a wonderful group, and Sheena Gordon, many people know, is one of many. We also have our Health Equity Institute leadership from the department who have been at the forefront of years of community engagement. And very importantly, we have our Health Equity Zones initiative that has been designed for moments like this and beyond, that we have infrastructures in place at the community level representing the voice of the community, able to connect to the partners in the community and push resources out into the community, as well as help understand where's the best place to get tested, where's the best place to set up vaccination sites, how do we best set up treatment and access to those sites. So being able to call you at the city level or to call us at the department if you are an organization that's interested in building that capacity to have vaccination. We'll welcome capacity for testing and treatment as well, any of the above, because the more local and reflections of the community we can have that set up in, the better. And just have in mind the types of requirements would be, you know, a team of people ready and able and willing to provide that service. It does take work, certain amounts of time and ability to engage with the community. So if it's not you as an entity yourself, you may be willing to support another locale. We can make any of it work, but it's first that willingness, and then also to have the right site and capacity. And once you reach out, either with you at the your office, Mayor, or with us, we are connecting. We're connected at the hip, our teams. So we would be eager to engage and see if it's a right fit for getting additional vaccination sites set up.
Thank you, Doctor.
So we have questions coming in both through the Zoom and through Facebook Live. So I'm going to try to do these in order. And I'll do the first one. This one was in Spanish, so Mayor, correct me if I'm wrong. Sandra wants to know how Latinos can help to share this information about vaccines.
Yeah, just continue to spread the word. Once you hear, you know better and you can do better, help other people do the same. We're hoping that everyone that's listening and watching this event tonight can automatically become an ambassador and help tell your loved ones. If you can imagine, the desire to change your action is significantly influenced when you have someone that loves you and cares about you and knows you telling you the message, like, this is good, it works, it saves lives, it keeps people out of the hospital, here's where you can go to get it done. The more we can have that, if each of you go do that to 3, 5, 10 people, that's how we can get the vaccinations out to the individuals that need it the most and who might not listen or watch the Facebook Live or might not hear it mentioned at the press conference, but we still want to reach them. So we are thrilled that we have however many more that are watching tonight, ambassadors, and that each of you can go tell, 3, 5, 10, 20, however many people you want to tell to go get vaccinated.
Yeah. So I hear 3 different kinds of concerns. The first one is, as Dr. Alexander-Scott mentioned, just anxiety and skepticism over the vaccine. And however, I think that the more that people see their neighbors, their friends, their family members getting the vaccine, the more comfortable they're going to be and the more likely they are to do it. So one thing that I ask of everyone is, when you get your vaccine, please put it on Facebook, do the social media thing. You can actually take pictures as they're giving you the vaccine. Let people know that you're doing it, and this will encourage other people to do it as well. If you're too young, or if you're not eligible yet, if you take a parent, or if there's an elderly loved one that you take, you can take pictures of them, and I think that this helps to make people feel more comfortable that the vaccine is indeed safe. The second thing that I hear from folks is, and people still don't know that they can actually get a vaccine. And I hear this most from people who are uninsured and for people who are undocumented. And so just continuing to repeat this, that yes, you can get the vaccine. There's no charge. You don't have to have insurance. We don't ask for immigration papers. Everyone is eligible. Please help us get that message out there. And we have to repeat it because by definition, we're working with hard to reach communities. So it's just repeating it at every turn that's going to help us get the word out. And then the last that I hear is around transportation. Either some people are homebound or just find it very difficult to get around and visit one of the vaccination sites. You can let them know that they can call my office at 311. And we've been working through these challenges on a case-by-case basis. But we have a lot of volunteers and we have a lot of people willing to help, and we will troubleshoot and we will find a solution to the challenge.
So I'm seeing a few questions on Facebook and through Zoom about zip code eligibility. If someone can just speak a bit about, whether you can only go to a Providence vaccine clinic if you're from Providence, how can you go to the Dunk, some information there.
So I can start with that. So remember that the doctor mentioned that there are 3 separate distribution channels. There's the state-run clinics, there's the city-run clinics and the community ones, and then there's the private pharmacies. For both the state-run and for the private pharmacies like CVS and Walgreens, you can go to anyone in the state you qualify for. However, since we in Providence, we know we're a hard-hit community, we've expanded eligibility in those zip codes just for people in those zip codes. So, so you have to be from Providence to qualify for the expanded eligibility within those zip codes. And you know, we've also received questions because some of the zip codes that we announced today, 02904 and 02905, they also spill over into Cranston. And they've called our vaccination sites. We only vaccinate people in Providence. At our clinics, we only vaccinate people from Providence. We've directed those calls for 02904 and 02905 on the Cranston side to Cranston City Hall. But you know, I hope that I know that helps to clarify. I know it's still a bit confusing, but if you have expanded eligibility because you live in one of these zip codes, just dial 311. You connect with my office, and we can either register you or answer any questions that you have. That might be the easiest way to go about it.
Dr. Alexander-Scott, a few questions about age eligibility and when that will change. I know you mentioned that in the presentation. Can you go over that again?
Yes, I know the question was asked about mid-March. We should be saying a little bit more this week at the press conference. We're continually looking for ways to accelerate, but within the next week, we will be expanding to the next group to stay consistent with our mid-March goal, since you know, that's coming up within the next 7 to 10 days.
And then another one, should we be worried about a 3rd surge of cases given the recent variants arriving in Rhode Island?
Yes, we are very concerned about the variants that are here in Rhode Island as well as in other states. It's why we are very cautious in terms of loosening restrictions. It's why we are pleased that we were as effective as we were in getting our hospitalization rates down so quickly in the communities where we started, so that we could withstand any concerns about a 3rd wave. One of the items we were wanting to tackle is getting as many people vaccinated as we can in advance of the variant really spreading. But we know that the variants are more transmissible than the non-variant strain. That means they are more contagious and can spread more quickly. So we're working to get as many of the people vaccinated as we can. We want to make sure everyone knows to continue to get tested every week, continue to wear the upgraded mask that you can wear. We are giving out those high quality masks at all of our testing sites. We're expanding that to vaccination sites, our health equity zone sites, as many places as we can get it to people, because that's going to be effective. And then making sure that you and your family members and your loved ones and your coworkers get vaccinated whenever it is eligible for you to do so, and spreading that word. With all of those tools, testing, treatment, and vaccination, we do feel like we have what it takes to get through and maybe even keep that 3rd wave from going too high.
Doctor, I have a question for you. So if you are vaccinated, we know that doesn't 100% protect you. It does protect you a great deal, but not 100%. And in particular with the variants, you can still get sick with the variants. If you've been vaccinated and you get sick with one of the variants, does the vaccination protect you from the degree of sick that variant can make you?
Yes, for the variant that we have identified thus far in Rhode Island, which is the UK variant, all 3 of the vaccines have shown effectiveness against that variant. With the additional information that Johnson & Johnson, the 3rd vaccine, has shown even greater effectiveness against that variant. So it's something that we are absolutely continuing to promote. The more people we can get vaccinated, particularly before the variant becomes most prominent, the more households can be protected. I'll also jump in with answering that to answer the Johnson & Johnson question that I saw, Teresa, about its effectiveness. One of the keys to focus on is that with Johnson & Johnson, Moderna, and Pfizer, they are close to 100% for its ability to keep people out of the hospital and keep them alive. That is the key element to really focus on, and then have the added advantage of knowing that Johnson & Johnson is just 1 dose, and that the data also show Johnson & Johnson is even more effective against the variant. When we look at our flu vaccines, the usual effectiveness in general for spreading disease is like 50 to 60%. So having 3 vaccines that are well above those numbers just for spreading disease is miraculous within itself. But we have 3 vaccines that are almost 100% for keeping you out of the hospital and keeping you alive. So that's the key we want people to focus on, and then think through, you know, get the 2 because that's available to me, or get 1. I would go with any vaccine that you are able to access. No need to pick one over the other or wait for one versus the other. Once you have access to it, take it, because it's in the 90 to 100% in terms of keeping you alive and keeping you out of the hospital. And that's the #1 public health outcome we want.
That's a great point, doctor. So like, which one is best, Moderna, Pfizer, or Johnson & Johnson? The first one you can get access to is the best one.
Absolutely. You want me to jump on the last one you just put in?
Sure. So this was from Facebook Live, just for those on the Zoom. What is the state doing to reach BIPOC communities?
So BIPOC is our Black and Indigenous people of color acronym, but referring to all of our communities of color. And we have, this is what I touched on earlier. We have, and I can actually advance the slide to reiterate that, our communities are the ones that are hardest hit. They overlap with our communities of color. And that's why we know our whole focus on health equity and what our health equity zones are designed to do, and what our partnerships with municipal leaders and others to address health equity is needed. That's important regardless, because it's no coincidence that these are the same communities that are most impacted by COVID-19. And so we want to make sure that, as the mayor shared, we're accelerating distribution by age. We're engaging with partners that are trusted providers. We are continuing to build that capacity. We're making sure that we're addressing language and technology barriers, making sure you can call if you're not able to go online, or you can walk into a site that's close to you, increase points of access, and then also push allocations into that community. And our team has done a phenomenal job within the last several days, mapping out what the increased allocation plan is going to be for those communities hardest hit. So we're looking to ramp that up and catch up in some of those areas that we had fallen behind. So we're going to correct that. In terms of pregnancy, what we know for now is that this vaccine is safe to get if you are pregnant or of childbearing age. The key we would want is for any woman who's pregnant or of childbearing age is to stay alive and to stay out of the hospital, particularly if you have COVID, knowing that there's 2 of you or more that are potentially here. And so that's why the getting the vaccine is what we are encouraging for pregnant women or women of childbearing age as well.
I have a question. I was told that if you have the COVID virus, you have to wait 90 days before you can get vaccinated. I guess, is that true?
That is not true. We are saying regardless of if you have had COVID, get access to the first vaccine you have access to and go ahead and get it. When you have COVID, it just means you have developed a natural immunity that is similar to getting vaccinated. But we are encouraging, even if you have that natural immunity, go ahead and get the vaccine-related immunity as well. You can be double covered. Just in case it wasn't clear, we want to make sure everyone has been vaccinated regardless of if you have had COVID or not.
This one is in Spanish. I believe it says, do doctor offices have vaccines in their offices?
It's a great question. Particularly in our zip codes hardest hit, we are working directly with doctors, offices, specific providers to help them get supplied with vaccines. One of the challenges is the way it's shipped to us are in these really large packages, and the way it's stored, there are multiple vaccines. So we can't give it to individual providers that have small practices or may not have a lot of patients that need it during one day, because we're not going to waste vaccine. Our waste percentage is 0.1%. It's extremely low. And that's because we have to really focus on those providers that are large enough to make sure that they administer all the vaccines that they have. And there's only but so small a unit you can make it. So we are engaging with specific providers, but really trying to build out that capacity, particularly across these zip codes that are hardest hit.
We have a few questions about folks that don't show up at vaccine clinics. Like, how do those appointments get filled, or how do people go about getting on a wait list?
So for the first part of that question, that allows me to repeat that we have a 0.1% waste rate, which means we are not wasting any vaccine. We are making sure. Usually we have an approach that allows for the next person who's eligible or in line to get called. We also have a very structured and thoughtful way to decrease the number of vials that are getting opened during the course of the day so that we're not wasting any vaccine. So we're applying a number of strategies to make sure that everyone that we can get access to, or that's eligible or that has scheduled, gets vaccines. For the wait list, going through the vaccine notification list, vaccine interest notification list at portal.ri.gov is a helpful way to let us know that you are interested, and then as soon as eligibility opens, we can let you know. Otherwise, continue to go onto the website or work with your pharmacy to determine when you can next get access to vaccine.
How far away are we to herd immunity?
We're actually, our goal is 70% of the entire population to really have herd immunity. Because we've been able to maintain the type of restrictions, we have given ourselves a healthy buffer that gives us a functional herd immunity right now while we continue to get more vaccines out there. As more people are vaccinated, we can start loosening some of the restrictions more and be able to maintain the level of herd immunity until we get to that over 70% realm.
This one is from Facebook Live. How should an individual who has been vaccinated live moving forward?
continue to follow the rules with masking while in public, continue to keep your distance, continue to wash your hands. Right now, I'm still continuing to encourage getting tested regularly, even though the vaccines are extremely effective at keeping people out of the hospital and keeping them alive. They're also very effective at making it so that you won't catch it or spread it. But because it's still possible and because the entire population is not vaccinated, it is helpful to identify if you're positive by getting tested regularly so that you can handle things differently, like stay home and isolate if you're a positive and prevent from spreading to other individuals who may not be vaccinated yet. So testing, treatment if you qualify, vaccination, mask wearing, and keeping your distance and washing your hands.
We got a very important comment. I just want to make sure we all thank Dr. Alexander-Scott for all she's been doing for us over the last year. Thank you. Just wanted to read that one out loud.
Thank you.
We got another one here. Do you anticipate that this will become a yearly vaccine like the flu?
It potentially will. We're all still learning, but my sense is that we will, because it's similarly a respiratory virus and does seem to have a seasonal approach to it. Our cases dropped across the country during the summer when more people were outdoors, and then rose again during the winter. So we likely will. Need it every year.
Is Providence or the state considering drive-through and/or outdoor vaccination sites, especially in light of the new highly contagious variant?
Yes, yes. All options are on the table. Mobile activities, as the mayor has looked into, drive up, walk up, making it as accessible as possible. We want to keep building out that capacity.
We have a question on Facebook about why the second dose hits people so hard sometimes.
Yeah, it's something that we are learning. That second dose really is allowing for the immune response to settle in because the body's seeing it a second time. And that immune response can lead to some of the achiness, sometimes fever in some people, sometimes tiredness. It does mean that it's working, but it has impacted a few people. The general report is that it's about 24 hours or so, and then people are fine after that. So folks being aware of that is helpful, and just knowing that people are fine once they get past it as well.
I think you covered this earlier, Doctor, but what percentage of the population is vaccinated? I'm assuming they mean for Rhode Island.
Mm-hmm. We're at about 25% for all of Rhode Island. But for 65 and older, we are just under 70%, I believe, 60 to 70%, and 75 and older, we're above 70%.
Got a question on Facebook. If we could talk a bit about the homebound approach for individuals who can't leave their home and need to get vaccinated.
Yes. We have a listserv for anyone who is homebound, particularly if you don't have a home health agency that is connected with you. That's on our website. If Joseph is still on, or one of our colleagues, they can put the information on here to go to the website to let us know if you are homebound or who you know that's homebound. And we are rolling out a program to be able to reach out directly during this month of March, to start reaching out to all of the individuals that we are able to learn of who are homebound and need to access vaccine. Thank you, sir.
got a question
put it in the
about,
chat.
as we get additional vaccine, will additional appointments online become available? Some folks are struggling to find open appointments.
Yes, absolutely. We're making it phase 2 is all about getting them out as quick as possible, as we've been doing. So the more that comes, we're actually pushing to the feds that we have demonstrated very high administration rates, and that should mean that we get even more. As soon as we get it, we'll be getting that out.
All right. Do we anticipate a booster shot vaccine in the future for the variants?
Still learning. It doesn't seem as if a booster, the way you think of like a 6 months from now type of booster connected to this first realm is needed. It might translate more into what I was saying earlier, that seasonally everyone, continues to get a vaccine the way we do with the flu vaccine. But studies are being done right now. So over time, we will continue to learn more.
We got a question on Facebook about whether they should get the vaccine if they have diabetes. Not sure if we can talk a bit about, folks consulting their medical providers or something.
Absolutely. Definitely feel free to connect with your medical provider, but also know that folks with underlying medical conditions like diabetes are at higher risk of being hospitalized, and that's exactly why we want you to get the vaccine. There are very few reasons that that people are instructed not to get the vaccine, and these reasons, underlying medical conditions, are actually the reason to get the vaccine, so that it can help protect you and keep a higher risk of being hospitalized lower.
All right, we probably have time for one more question, and then I want to acknowledge folks probably need to give some closing remarks. Recent news article mentioned that the vaccine focus has shifted to prioritizing second doses. Does this reduce the number of doses per day and available for first allocation?
Yeah, so because we did an additional push a couple of weeks ago on getting more first doses out, it does mean the limited supply that we have will be focusing a significant proportion on getting those second doses through within the coming week or so. It's not going to slow down the schedule that we are looking, pushing forward, but it is impacting how we are proceeding because we need to get those second doses into individuals. So that's where we need more vaccine so we can continue to make it available.
Awesome. Well, I want to be mindful of time. Dr. Alexander-Scott, do you have any closing remarks, or Mayor Elorza?
Well, just thank you to everyone for listening. And I want to repeat the point about you all now being ambassadors to this message, and to please take the positive message about vaccination with you to your loved ones, to those you care about, to those you work with, especially if you know that they're questioning or might not otherwise know about the access to a free vaccine that can keep them alive and keep them out of the hospital. So please spread that word. Help us save lives together. That's what public health does. So thank you for being public health ambassadors for us tonight.
And thank you so much, Dr. Alexander-Scott. Again, we really appreciate everything that you've been doing, literally on the front lines, and appreciate your time today. Like we've said, this is like a world war, and we're all on the same side, and it takes every single person stepping up to be part of the solution. So all the ambassadors out there, we appreciate you being here, and thank you for spreading the word. And what I will also say is, probably the simplest thing possible, we have our 311 line. If you have questions or anything that you want to run by us, anything that you want to double check, you can always contact us through 311, and we're here at your service. So thank you so much, everyone. Thank you, Dr. Alexander-Scott, and I look forward to doing this work together as we crush this virus.
We will.